and get started. Welcome, everyone. I'm Catherine Pierce. I'm Chief Operating Officer for the National Task Group on Intellectual Disabilities and Dementia Practices, and we welcome you to our webinar this evening. This is kind of a special webinar related to a special project that the NTG is involved with, and we want to give special thanks to Special Olympics for funding this project. And just a couple of quick housekeeping things. Everyone is muted by default. If you have questions, please put your questions in the Q&A box. It's either showing up at the top of your screen or the bottom of your screen. In a little bar there says Q&A. If you click on that, you can type your questions in. And put your questions in whenever they pop into your head. We will be taking questions, but don't feel you have to wait to type them in until we get to that point. Go ahead and put them in now. We'll be monitoring for those questions. If you have technical type questions, you can put those in the chat box, but questions related to content, please put those questions in the Q&A box. And I'm gonna go to the next slide. Before we get to our speakers, I want to introduce Natalia Rosas. Natalia is our administrative assistant and project support for this Changing Thinking project. She's going to be monitoring the chat box and the Q&A box for your questions. So again, just put those in at any point, and we will look forward to those questions when we get to that point in our presentation. But before we get started, just want to very quickly introduce our two presenters for this evening. Nancy Murray. Nancy has been a longtime friend of the NTG. She's on our board of directors. And she and her husband have 3 adult children with Down syndrome. And Nancy was one of the founders and first director of the Down Syndrome Center at Children's Hospital in Pittsburgh, and president of the ARC of Greater Pittsburgh, and senior VP of Achievia. So she has lots and lots of experience in areas of public policy and advocacy, family supports, and so forth. So we welcome Nancy to talk about this new program this evening, and also Helen Stepawani, who has been with the NTG for many, many years now as a steering committee member or board member, and is now project manager for our Changing Thinking project. Helen's in New York State, and she has spent her entire career working to improve services and supports for children and adults with intellectual developmental disabilities and their families, and has held many positions in New York State, including with Upstate Cerebral Palsy, Finger Lakes Cerebral Palsy, the Kelberman Center for Autism, and Kennedy Willis Center at Pathfinder Village. So if we have folks from Pittsburgh or New York, you know, you are well represented by these two well-connected and highly knowledgeable ladies. So with that, I am going to turn this over to Nancy Murray to get us started. And so Nancy, take it away.
Okay, well, welcome everybody. Thanks for joining us this evening. Now you know a little bit about Helen and myself, but we thought we would also talk a little bit about all of you who have joined us this evening. And you can see that this evening, whoops, slide went faster than me. We have people on the call tonight from 35 states, our friends up in Canada, and then some other countries. So we are quite a diverse group this evening. You can also see that the people that responded to the survey upon registering, you'll see that we're evenly split. People who actually are caring for somebody right now with dementia, kind of evenly split with people who are not yet or right now caring for somebody with dementia, but also a good number of people who are not right now caring for somebody, but who are suspecting that a loved one does have potentially symptoms of dementia. Next slide, please. Okay, a little bit more information about everybody on the call tonight. We asked people, what are your greatest challenges as a caregiver? and you'll see that at the top of the list, many of you answered understanding dementia and in specifically in people with intellectual disabilities. You're concerned with managing behavioral changes that you're seeing in your loved ones. I think that everybody on the call who's a caregiver at one time or another, we are all worried about how we're going to manage stress and burnout as caregivers. Many of our loved ones are also experiencing communication difficulties. Boy, I'll tell you, when it comes to lack of respite or support services, I have yet to meet a caregiver of someone with an intellectual disability who would not like to have more respite. Also at the top of our list, I don't think this comes as any surprise to anybody. One of our biggest challenges is accessing medical care and specialists, and especially caregivers in rural areas. And then last but not least, one of our biggest challenges and stressors is navigating legal, financial planning, all of the complex systems. I would also probably add to that list physical and behavioral health care, Medicaid waiver services, because each of those systems has its own rules, its own regulations, its own eligibility requirements. So when you put all of those together, I think we can really understand why, caregivers of people with intellectual disabilities and dementia are facing so many different challenges and stressors. And we're going to be talking a little bit about those in greater detail this evening. Next slide, please. Okay, so what are our goals for this evening? Well, first and foremost, it's to help you understand more about the CMS Guide program. Remember CMS, what that stands for. We also want to help clarify what the eligibility requirements are for adults with intellectual and developmental disabilities. We also want to help you to understand how Guide may benefit you as caregivers and your family member. And then last but not least, to identify next steps on how you may be able to access Guide services. Next slide. So let's talk just briefly about what is this. And I have to underscore, this is brand new. As you'll see in the first sentence there, this is an 8-year program. It was just established last year. It is very, very new. And it was established, developed by the Centers for Medicaid and Medicare Services with the express goal of providing quality care for people with dementia. And how it does this is by creating an alternative payment model for healthcare organizations and clinics who deliver services to people with dementia and their caregivers. You're going to hear more tonight, more specifically about all of the services that are available through Guide. But on whole, these services are very comprehensive. They're based on person-centered assessments and care plans. Care coordination is involved. And one thing that I think all of us can benefit from is a 24/7 support line, because as caregivers, we don't work 8-hour shifts all the time. Sometimes we end up at 2 in the morning having time to obtain information, right? And again, the mission here is to allow people who are diagnosed to live with dementia to stay safely in their homes for as long as possible, to improve the quality of their life and the lives of their unpaid caregivers. Next slide, please. So I'm sure you're asking, okay, I could begin to understand how this might benefit my family member. How is it going to benefit me as a caregiver? So, as we said, the model offers people with intellectual disabilities and dementia and their families the opportunity to receive interdisciplinary dementia care services and support through what are known as guide participant providers. And Helen's going to talk more about who those guide participant providers are. But you'll see some words there that are bolded. Interdisciplinary, that means we're going to be able to receive services, again, physical health care, behavioral health care, care coordination. You're going to hear more about these services. And also the support services that are really designed to help caregivers, unpaid caregivers, to continue to provide care for their loved ones, to enable them to stay in our homes as long as possible, hopefully forever. Next slide, please. Services included under guide. We've mentioned having a comprehensive assessment available, and this would be an assessment of our loved ones, but also what we need as caregivers, coming up with a good plan for how care is going to be given to people, ongoing monitoring and support. You're just not going to have a written care plan and, go off on your merry way. There's going to be the opportunity for professionals who you're going to be working with to continue to monitor the supports you're receiving, your loved ones receiving, to make sure they're continue to be high quality to meet your needs. Also help with some medication management. I think every caregiver at some point in time worries about whether or not we are following through with all of the medication. Are we giving it at the right time, the right dosage? As we said a minute ago, access 24/7 to a helpline, to care team members who first of all, will have access to all of our information and can answer questions, offer resources, walk us through some of the issues that family members may be having. We mentioned the care coordination, transitional care management. I know Helen's going to talk a little bit more about that. Referrals to services and supports locally in our communities that we may not even be aware of. Caregiver education. Sometimes, I'm sure everybody on the call, at some point in time, we just need information. We need information about some of the medical diagnoses our loved ones might be having or receiving. We just continually need education about, medication, about services and supports. The list is almost endless about the kind of education and resources and support that we need. And last but certainly not least are ways that we may be able to access some respite services. Next slide, please. The eligibility requirements. This is important. I'm sure you're sitting there wondering, okay, is this something that my loved one and I might be eligible for? So first of all, your loved one must have a diagnosis of dementia that is confirmed by a clinician, and Helen will get a little bit more into, who those practitioners are. This is important. Your family member must have Medicare as their primary payer. So they may be dual eligibles. They may have, Medicare, Medicaid, but they have to have Medicare as their primary payer. They must be enrolled in Medicare Parts A and B, but not necessarily involved or enrolled rather in any Advantage or special needs plans. And they do not receive Medicare hospice benefits or are long-term nursing home residents. So if your family member meets all of those eligibility requirements. This guide program, brand new, as we said, may be something that you and your family member are going to be able to benefit from. Next slide. Okay, this is where I turned it over to Helen.
Thanks, Nancy. And I also just want to check in with Natalia, who has been monitoring our Q&A box, just to see if we have any initial questions from this very introductory information that Nancy has shared with you about the guide program. Natalia, have you got anything to share with us?
I have one question. Is there a definition for long-term nursing home user? Like long-term is 1 year, 10 years?
Yes, I was going to say, so we're talking a little bit here about eligibility requirements. And because of how the guide program is funded and because of how this is set up under the Centers for Medicaid and Medicare Services, there are particular funded program models for elderly people who may have dementia that may currently exist. So this would be someone who is currently placed in a nursing home. If this is an individual who is currently living as a resident in a nursing home setting, in a certified nursing home setting, they would not be eligible to be part of the guide program. The other things that would also negate eligibility would be if they are currently enrolled in a Medicare Advantage program as a healthcare program, as their health insurance program, that would negate their eligibility for guide. And also the third thing would be a PACE program. PACE programs are all-inclusive programs for elderly nursing home level of care individuals. So older people who require a nursing home level of care, but rather than being placed in a nursing home are being served through a community-based PACE program, P-A-C-E. And because of how that program is funded and regulated, that would be considered to be very comparable to a nursing home level of care placement, and that would also mean someone would not be eligible for guide. As Nancy said, guide is a very new program. It really just rolled out in July of 2024. So we're not even 12 months into the guide model. Healthcare providers across the United States had an opportunity to apply to be a guide participant organization. And there were approved to be part of guide an initial just over 375 organizations, healthcare organizations across the United States who asked CMS for approval to be part of the initial guide model. Those 375 plus organizations became active in guide through two different tiers of organizations. The initial group of organizations approved to be up and running as part of the guide model were about 90 organizations that already had very established dementia care programs in terms of healthcare services for people with dementia. And those initial group of 90 became active and involved in guide. As part of the first tier that were approved to begin and open in 2024. That was that group that opened last July. There is a whole additional group of organizations, more than 250, that will be becoming live, active guide participant organizations in July of 2025. So a couple of months from now. And so by the time we are into the fall of 2025, you're going to see a pretty comprehensive group of organizations. And we'll show you a little bit about where those organizations are and how you can find out where they're located. Natalia, was there any other question or can we move on?
You can move on. That was the only one so far.
Okay, thanks. So we talked a little bit about what are those eligibility requirements. So the things you have to have are that you would be enrolled in Medicare Parts A and B, and that someone has a diagnosis of dementia. If that you have a family member where there is then some screening and tracking being done, where there's a suspicion of dementia, but the full diagnosis has not been achieved yet, that may still be something that would not prevent you from applying to be part of GUIDE, and your ability to be eligible and enrolled into the GUIDE program would be determined as part of a comprehensive assessment that would be done at the time that you would have applied for the program. So let's talk a little bit about who's who in the GUIDE program. And thanks, Catherine, for putting this up on the screen for us. So these are terms that you will hear over and over again if you look at information about GUIDE. The GUIDE model considers individuals with dementia who are going to be receiving services through GUIDE. They are considered beneficiaries. Some GUIDE programs also refer to them as their patients, but if you see the word beneficiary or patient connected with GUIDE, it is an individual with dementia who is then determined to be eligible for GUIDE. And this does include adults with intellectual and developmental disabilities. Our goal in meeting with you all tonight and sharing this information was to really make you aware that as this program unfolds, that this is something that may be very beneficial to families who have a family member with an intellectual or developmental disability. One of the first people you would meet if you were making an inquiry of a GUIDE participant organization as to whether your family member would be eligible for GUIDE would be a care navigator. And care navigators are healthcare navigators who would be those initial points of contact with family members and would be assisting you with your navigation through the GUIDE care delivery services and everything that you would be able to benefit from, that your family member would be able to benefit from, and that you as a care provider would be able to benefit from as well. GUIDE practitioners are Medicare enrolled physicians or non-physician health practitioners. So this can include nurse practitioners, it can include physician assistants, but they are considered under the GUIDE model to be GUIDE practitioners. GUIDE model participants are these organizations that I mentioned who are either part of the first tier of GUIDE organizations that came on board in July of 2024, or part of the second tier that will be becoming part of GUIDE in July of 2025. And then all of those 350 plus participant organizations will be carrying out the GUIDE model over the remaining 7 years of the program. So these are Medicare Part B enrolled healthcare providers that are participating in GUIDE. And so that means they applied for and were approved by CMS to be able to be part of the GUIDE program. And then partner organizations are going to be other types of providers or healthcare organizations or support or community-based organizations who also provide services to beneficiaries. This could include disability organizations. So one of the things that we have learned about GUIDE and that is becoming very clear is that the healthcare system knows that they are going to need the resources of the community, including disability provider organizations, to be part of the integrated care model that GUIDE is envisioning to be when this new model is fully up and functional across the United States. And so one of the things that we wanted families to certainly be aware of is that as more information about GUIDE is becoming publicly known, that disability provider organizations may be able to be playing a part in the GUIDE model through subcontracts that they would have with guide model participants, those healthcare organizations that are in the guide program, and that perhaps services such as community-based supports or services such as respite care, or even care management, case management may be able to be provided by subcontract arrangements with partner organizations. Next slide. One of the certainly questions that many family members, and rightly so, have had about GUIDE is, if I am not eligible because of nursing home, living in a nursing home, or because my family member is involved in a PACE program or a Medicare Advantage program, my family member gets a lot of wonderful HCBS, home and community-based waivers funded services. And certainly that's something that we have seen develop significantly across the United States over the last 15 years. One of the good pieces of information for you all to know is that enrollment in GUIDE does not impact your family member's eligibility for waiver services they're currently receiving or may receive in the future. So there is, and when we talk about integrated care, we know that, and what is being envisioned with GUIDE is that there can be really an alignment and collaboration between what healthcare providers who are part of GUIDE can offer and the community-based services that family members of people with intellectual and developmental disabilities have come to rely on, and who are very knowledgeable in most cases with the needs and the challenges faced by individuals with intellectual and developmental disabilities who perhaps are experiencing some age-related decline. And that we know it is going to be the knowledge and resources of those community-based services that we will want to be able to inform the healthcare team that would be supporting through the GUIDE participant organizations. Next slide, Catherine. So what are the things that we think we want you to really know about GUIDE? And some key points are what you see on slide number 12 here. Under GUIDE, caregivers are defined as family members, friends, or any unpaid individual who provides regular assistance to a beneficiary. Again, keep in mind that beneficiary is the person who is living with dementia and who is receiving services. So we also know that many individuals with intellectual and developmental disabilities may be living in care settings that have paid staff. Paid staff would not be considered caregivers under the definitions of GUIDE. But we also know that even in community supported settings with paid staff, that there is a lot of unpaid time with significant people who provide care and support that enrich the life of a person with a disability. And so under GUIDE, one of the great things is that when we look at benefits that caregivers can experience and receive under the GUIDE program, though that definition of caregivers is quite broad to include yourselves as family members, friends, or any unpaid individuals, a community friend or neighbor who checks in on someone every day, who may be living in a supported apartment setting in the community, or maybe living independently in the community with some check-in from time to time by both paid and unpaid staff. When we talk about caregivers, one of the pieces, and Nancy, I think, certainly referred to this and talked about this in her earlier remarks, is that burnout and demand on caregivers can be significant, particularly when someone is experiencing a healthcare challenge such as dementia. Dementia is not one size fits all, and the progression of the healthcare challenges that a person with dementia may experience are significant. So the availability of respite services is really essential and important for anyone who is living with dementia or providing care to a person who is living with dementia. Respite services are a guide-funded service, and that is a terrific piece of information that is so important for you to know and for all of us to keep in mind. These respite services that are available through Guide have an annual dollar amount that's a cap, and that's about $2,500 per year. And a year is calculated from the time the individual is enrolled in Guide. So this is not a calendar year, but it is a 12-month period, a 12-month year. So let's say your family member applies for and becomes active and enrolled, approved to be part of Guide in, let's say, in September of a given year. Then that's when the clock starts ticking on the first year of respite, financial support for respite services. Where those respite services are provided and who provides those services will vary depending on what community-based supports are there, what services the Guide participant organization themselves may have, or they may have established subcontracts with community-based disability providers or other community-based supports to provide respite care under a subcontract arrangement. So there is an annual cap on the amount of financial support available for Guide. And as I said, that annual cap is in the neighborhood of $2,500, and the clock starts ticking at the time enrollment first happens. It is renewable annually based on the anniversary date of when your family member is enrolled in Guide. We want you to remember that the HCBS waiver, home and community-based support waiver, those beneficiaries who get waiver services now will not lose those services if they become enrolled in Guide. So there is a really wonderful way to really expand the base of support that a individual with a disability can experience if they also are diagnosed with dementia. And that can be provided through an integrated care team of healthcare providers, as well as community-based providers and disability providers that are part of a person's life. Family caregivers are a key part of the Guide care team, and Guide was established and the Guide model was established with the clear understanding that family caregivers needed support and would need access to information and would be considered to be members of the care team. So if right now you have a family member who perhaps is being screened for dementia, but has not been fully diagnosed, there is an opportunity for you as a family member to share the information that you have been gathering, the documentation perhaps that you've been keeping, or perhaps the screening that you have been using. I know a number of people on this webinar tonight are familiar with the NTG's EDSD, which is a screening tool that was designed specifically to look at changes in function for individuals with intellectual and developmental disabilities. You may have an active way that you use the EDSD to track and monitor changes in your family members' daily activities and ability to function in different settings. And that is information that certainly a healthcare team that's part of Guide would benefit from being familiar with and learning about from you. So you're going to really be people who will be active members of this care team. The last point that we wanted to make sure that you would be aware of as a family member or a caregiver is that Guide is a new program. And I actually was in on a webinar earlier this afternoon with health participant organizations that are part of GUIDE from across the country, sharing information about some of the challenges they faced and sharing solutions to some of the new program startup challenges that they have experienced. So GUIDE is a new program, and some healthcare providers and some disability providers may not yet know anything about what GUIDE is or how it may benefit you and your family member. So there's a certain amount of a learning curve that is happening here. It has part of bringing on those tier 1 healthcare participant organizations in GUIDE was to really begin the program with established dementia care providers who had very strong evidence-based healthcare models running across the United States, and then to gradually give newer model dementia care programs the opportunity to get themselves ready, trained, and up and running to begin to join in the GUIDE model in 2025. Catherine, want to move on to the next slide for us? So this is, again, just a summary of what those supports are for family caregivers and for caregivers in general. The respite services that I spoke about previously, the maximum is $2,500 annually. This is not a grant that you receive upfront, but it is paid through the GUIDE organization that is creating the comprehensive care plan for your family member. And those respite services will be billed by the respite provider back to the health participant organization, and they will be reimbursed by CMS. So there's a little bit of sequential billing that happens here. Typically, we're hearing, based on the meeting I was in today, that most respite services are being billed in chunks of about 4 hours of time. And keep in mind that $2,500 cap is an annual cap that begins at the time of enrollment and then will follow for the next 12 months for your family member, and then would, if it is determined that your family member continues to be eligible in GUIDE, this is expected, as I said, to be an 8-year program, then that $2,500, if respite services are part of the care plan for your family member, then that $2,500 for respite services would be renewed, and that's a maximum cap for the following year as well. Comprehensive care planning. The thing that we know is that a really well-designed care plan will need to be monitored and need to be changed and evolve as a person's life evolves and changes. Early on, when someone is first diagnosed and perhaps their symptoms of dementia may be more minimal, the level of care and community supports and family supports that may be needed, as well as healthcare supports, may not be as significant as they would be at mid-stage or later stages of the disease process. So care planning is something that will be conducted on a regular basis by the care team, and it is the role of the healthcare navigator to really be assisting you as the family and your beneficiary, your family member with dementia, with ongoing monitoring for periodic screening. If there is a need for a specialist review or significant change has occurred, that they would arrange for an immediate access to get services to where they are needed most. One of the things that we certainly want to see, and one of the things about GUIDE, when you look at the letters GUIDE, it was standing for Guiding an Improved dementia experience. CMS has recognized that in order for care to be maximum and to be optimal for a person who has an intellectual disability and dementia, or a person without an intellectual disability, but a person living with dementia, there needs to be the right healthcare supports and community supports for the individual as well as for their caregivers, wherever those caregivers may be and whoever those caregivers are. Caregiver education and support will be ongoing. And at the time that someone is enrolled in GUIDE, one of the really high priorities is to provide you as caregivers with as much current evidence-informed information as available. The goal is to really give you access to dementia care experts and a team of experts who can help you and your family member navigate the challenges of this disease and also improve the quality of life for your family member as they are living with dementia. Care navigation, your care navigator, really the availability of supports for you on a 24/7 basis is something that was built in as part of the GUIDE model and would be available for you, whether it's by phone, whether it's in person, whether it's through text, whether it's through email. It's going to be a number of options, that some of which can really maximize use of technology, some of which will be in person, and some of which may involve some on-site screening and evaluation processes with the GUIDE participant organization providing your family members care. So with education and support and navigation, the goal is to really broaden the resource network of experts that you as families have available to you, and for the understanding to be there, not only of what your family member is experiencing given their intellectual or developmental disability, but also what they are experiencing given the disease process and the diagnosis of dementia, what that means for you, what it means for them, and how you can plan not only for today, but also for tomorrow. Catherine, next slide. So when you think about this is a pretty daunting topic and a pretty daunting experience. One size does not fit all when it comes to dementia. We know that. And one size does not fit all when it comes to any person who is living with a developmental or intellectual disability. So what can you be thinking about as caregivers as you think about your own family member? And if you're not a caregiver right now, but you are perhaps representing a provider organization, a disability provider in a community, you might be in a municipal area with thousands of people around that are part of your community population, or you may be in a very rural area with limited resources. So one of the things that you want to do is really to start to get your house in order around those eligibility pieces. You want to make sure that your relative, family member, or the adult with intellectual disability for whom you provide care is a Medicare beneficiary. So that's one of those initial things you just want to create your checklist, that you have things you're going to check off. You can make a self-referral to a GUIDE participant organization, or your primary care doctor, your case manager, if you are currently working and have had a long-term relationship with a disability organization in your community, or you have a case manager, a care coordinator, they can make a referral for you to the GUIDE organization that is in the catchment area where you live. Once that referral is made, you should expect that you're going to hear from a local GUIDE navigator to set up an interview with you. And where will that interview take place? It's going to vary. It may be by initial contact with a phone interview. It may be a Zoom interview for those of you with technology. They may ask you and set up an appointment for you to come in for a first meeting with them at a site where the healthcare organization is. But you can expect there will be a contact made by a navigator from the guide organization once that referral has been made. So when that contact is first made with you, you want to be ready to provide information on what life is like for your family member and for you as a care provider during that home visit or initial interview. This is a time to really set the stage and provide to them the information that you have about your family member, what you know they need, what your experience has been, and the pieces of information that are really going to be foundation pieces to let them get to know your family member as quickly as possible and as accurately as possible. This is where, for those of you who have kept, and I know many families do, a log of the history of your family member, their interactions, their likes, their dislikes, what has really been an important quality of life factor for them in really fulfilling, having a fulfilling life for them, what is really important. They also are going to want to know about your level of caregiver stress. What is happening for you as a caregiver? What are the greatest demands that you're experiencing? What questions do you have, so that they can begin to build that into the comprehensive care plan that will be developed for your family member and for you. Always be prepared to provide more information as the local guide participant reviews your application. They may see initial information and say, oh, we need some more. And so we want to be patient, but we want to be as complete as possible in terms of providing that information. If there is any diagnostic information of any kind regarding the diagnosis of dementia, screening for dementia for your family member, please have that available to share. That information will be very important, because remember, a diagnosis of dementia is one of the requirements to be fully enrolled in guide. For some of you, it may be that that diagnosis needs to be confirmed. There may be a suspicion of dementia, but there has not been a confirmational diagnosis. And perhaps because there was not an appropriate specialist to conduct that assessment and to complete that diagnosis. The guide organization will be prepared to be able to assist with that, and we'll have the team of specialists and experts available to be able to provide that confirmation of diagnosis, or to rule it out if indeed it is to be ruled out. And you want to be able to come in with a list of supports that you may want or need to help you with your caregiving. Catherine, next slide. It seems like when we have a family member with a disability, that the list of what we should be doing, can be doing, should be doing as a parent, as a sibling, as an adult sibling, or as a caregiver, that list is never ending. It is very long, it's very comprehensive. But what are those other things you can do? So you've figured out where your closest guide organization is. You've talked to your disability or community-based organization about guide, and you've got someone working with you to get some more information. You've started to collect the information about your family member in order to make sure that there is a complete picture of their history, and there's the things that really enrich their life and makes them really experience the quality of life, puts them in the driver's seat of their life as long as possible. You also have created that list of what are the challenges you're facing as a caregiver, care provider, and how guide might be able to be of assistance to you. What are some of the other things that you can and should be doing? we want you to be able to locate your closest guide healthcare organization. And in just a minute, we're going to take you to the next slide, which is going to show you an interactive map you can go to online that will help you locate a guide organization closest to you. This is a time for you to share as much information as you can about GUIDE with your own local disability providers and waiver services providers. This is the time to start talking to others about what GUIDE is, what you're learning about GUIDE, and what you want them to know about GUIDE, so that you are all really sharing a common understanding and a common language about this very unique program that really can be of such benefit to people with intellectual disabilities and dementia throughout the United States and beyond. We encourage you to stay connected with us as the NTG. When Catherine introduced us as being connected with the Changing Thinking Project, the Changing Thinking Project is a special grant that the NTG received from Special Olympics to help really address how the NTG can support people with intellectual disabilities having ready access to the GUIDE model, to GUIDE services, and to helping also prepare GUIDE organizations to better understand the unique needs of people with intellectual disabilities who also live with dementia. So it is a project that is really focused on information, education, referral, and really building the capacity of the healthcare system and the GUIDE program to understand and to be able to meet the unique needs of people with intellectual and developmental disabilities who are also living with dementia. You can access our Changing Thinking project information. We actually have on our NTG website a special section that talks about this particular project. We are updating it on a regular basis and will continue to do so going forward, so that in terms of resources from the NTG related to the GUIDE program and how we can assist you as family members to get the information you need to get you connected to GUIDE is really a huge priority for this project. So we want you to certainly check in on our website and the Changing Thinking project on a regular basis. And this is the time where the tremendous advocacy that you as family members have undertaken from the time your family member was born and became part of your family. This is the time to really continue to reactivate your advocacy genes and your advocacy activities. We want you to ask questions. We want you to be a positive advocate. This is a time to make sure that there is an open door for individuals with intellectual and developmental disabilities to the GUIDE model services, and that we want to be able to remind healthcare providers across the United States that people with intellectual disabilities are diagnosed with and experience dementia as well, particularly individuals who are living with Down syndrome and that who are at maybe at a greater risk of developing early onset dementia. So this is a time when our advocacy voices need to be heard, and you as parents and family members are the most powerful voices to speak on behalf of your family members. Next slide. Catherine, yes. So I talked a minute ago about where are the GUIDE participant organizations throughout the United States. This particular slide also has code that you can put your camera right on and be able to link to CMS's interactive website, where you can type in the location that you are and find the GUIDE participant organization closest to you. It is really something that is really helpful, and we encourage you to go to this interactive GUIDE website. all the information you would need to identify the guide organization closest to you, their address, their website, and contact information for how you can connect with them through this particular interactive map is something that you will find very, very beneficial. Next slide, Catherine. I also would say that when the NTG was established and then incorporated, it is really an organization that was founded recognizing the specific needs of older adults with intellectual disabilities who are at risk of or who have already developed Alzheimer's disease or a related form of dementia. The NTG really wears a lot of hats and has been an active presence advocating for federal policy changes, publications that inform and raise awareness regarding the unique needs of people with intellectual disabilities and dementia. We've been providing training to hundreds and thousands of healthcare providers and others throughout the United States and Canada. Our partners in Canada are a huge piece of what's been happening in North America. We also have been collaborating with other national organizations to advance research and policy change on behalf of family members. And we also do have a monthly online family support group that Nancy can speak more specifically about. So we encourage you to really take advantage of this QR code, go to our website and stay in touch with us. We will add you to our mailing list and would be happy to have you become a partner in the work we're doing to really bring the needs and the challenges and the opportunities to strengthen healthcare to benefit people with intellectual and developmental disabilities across the United States and really around the world. So thank you very much for that. At this time, we want to open things for some questions, and I know that Natalia has been tracking our Q&A box. We also, let me say, while we are going to go through these questions, we have some follow-up questions that we'd like to ask you related to tonight's webinar. What was most helpful to you in the information that we provided tonight? What would you like to know more about? Because we know this will be the first of what will be several webinars geared at families and providers. And we really want your needs to guide the content that we will provide for our next webinar, date yet to be determined. So while we are addressing our questions and answers over the next few minutes, you can go right to this link. And it's also going to show in a new window when the webinar is over. But we'd be happy and certainly appreciate your feedback, your guidance, your constructive input, and recommendations for how we could continue to offer the information you need as caregivers, family members, and providers in our future work that we're going to be doing on this topic. Natalia, what have we got in our Q&A? And I know Nancy is back. I'm going to ask Nancy to unmute. And Catherine is with us as well. So across our group here, we are going to do our best to answer your questions.
All right, here, there's several questions. So Tammy asked, is the program similar to a HCBS program with Medicare as the payer instead of Medicaid?
Yes, it is similar, but one does not negate the other. So that's where the point we raised about the Medicare eligibility under parts A and B is a requirement in order to be eligible for GUIDE, but because you may also be receiving HCBS waiver services does not negate you from being part of GUIDE.
All right, a couple of people, George asked, will the GUIDE program survive the current administration in DC, especially as so many programs are being eliminated? Liz asked a similar question, has there been any chatter about the status of the GUIDE program in relation to the cuts at CMS?
think to answer that question, if we could answer that question, Helen and I would be independently wealthy. There is absolutely nobody on the face of the earth right now that can answer those questions. But all we can say is that we are very hopeful that we will, you know, make it through the next round of cuts. But
Yeah.
nobody can answer that right now.
And I just want to applaud Nancy on that. Yes, we would be independently wealthy. I will say, so I was on a national webinar late this afternoon of the Dementia Care Collaborative from across the United States, and two organizations that were presenting as part of that, one from California, one from Emory University in Georgia. And we are not hearing in the most recent national webinar of today that there has been any known or identified cuts or changes to this. These were webinars that talked about coding and billing and how payments should be being submitted for payments, things like that. This was all in the people that were on this were healthcare participant organizations that are part of the GUIDE program. So it is active and involved. It was approved as an 8-year model, but as we also know, the current budget is working its way through the legislative process, and we won't know what that budget will look like until it's finally adopted and approved. So, yeah.
All right. Doug has a question. He says, is there an age minimum requirement for a GUIDE beneficiary? I have a 45-year-old Down syndrome daughter who has been diagnosed with dementia and Alzheimer's.
There is not a minimum age, no. Medicare eligibility is what one of the requirements are. And as we know, there is can be a waiver for an earlier Medicare eligibility requirement. So I would, but in terms of GUIDE itself, there is no minimum age or maximum age. The eligibility is tied strictly to that someone is not in a nursing home, not part of a PACE program or a Medicare Advantage plan, but is a Part A, Part B Medicare approved beneficiary, and it has a known or suspected diagnosis of dementia.
All right. George has a question. How many hours of respite care would be covered by $2,500 a year? And what would be an approximate range of how many hours?
Yeah. So respite was something that was talked about a bit today in the meeting that I was on earlier. And as I said, it will depend a lot on the subcontract that the GUIDE participant organization. So when I say GUIDE participant, that might be a healthcare system that would be, that has been approved to be part of GUIDE. Okay, so let's assume it's a healthcare system, and they're not going to provide respite themselves. They decide they're going to contract with a local ARC provider in several communities because they're a big regional healthcare system. So maybe they're providing with some disability provider organizations. Wouldn't have to be ARCs. It could be any disability provider organization. And so whatever the arrangements are in that individual subcontract will be the rate of pay that will be established for that reimbursement. But based on today, they did say 4-hour blocks of respite seem to be a fairly standard amount. And that, and again, we're only 10 months into this project, so it's some of these are still being, I think, developed over time. Also, that the going rate of what it would be for a respite may vary depending on the region and the location. We do know that the cap, though, is the same no matter where the individual is located. So the $2,500 cap would be based on the hourly rate that's established in that subcontract arrangement based on the regional rates that are being used in that area.
All right, thank you. George also wants to know what happens after 8 years.
That's another one of those future pieces of when you look at what are the goals of GUIDE, what did CMS say the goals of GUIDE were? It was intended to be an 8-year project to provide an alternative payment methodology and with a goal of reducing nursing home admissions for people living with dementia, who may require very extensive care as their dementia disease progresses. If at-home care can be, and a network of care can be developed that also includes caregiver education, respite support, and a network of 24/7 access to a variety of supports as needed. The intent is to show this could be done with some level of cost efficiency and an improved quality of care that reduces nursing home admissions. The 8-year time frame is intended to really evaluate, did that really happen or not? And there is a broad national organization that CMS has retained to do the evaluation side of this project. So we are at the very beginning of what is intended to be a multi-year project, and hard to know what the results will be and where that will take us after the 8 years. Don't know. Nancy, do you want to add anything to that?
No, and again, I don't think there's anybody on the face of the earth that could answer that question tonight. And if we could, we would be wealthy.
Yep.
All right, so Katie asked, are individuals who live in certified residences like group homes under HCBS waiver eligible or only for living home with caregivers?
No, people who live in group homes that are funded under the waiver are eligible for GUIDE. That was one of the very first questions. We actually took that question right to CMS in a meeting we had with them last summer when we started this project, because that was a huge issue that we knew would be a concern to all families and people across the country. So yes, so someone can be living in a group home. They can be living, it just cannot be a nursing home setting. But yes, group homes are still eligible, not a problem.
Ruth asked, where can you get more information about GUIDE and how to sign up? I think you covered that a little bit.
Yes, that website, that the slide that showed the map also has the CMS website there. And so,
put that in the chat box too, the link to that. So
yeah,
I put that in the chat. Yeah, so you can find it there.
mm-hmm. Okay.
All right. Carol asked, the interactive map shows memory care in the Asheville, NC area. However, when I ask about my son with Down syndrome, they would not consider taking him as a patient.
Was it a GUIDE program?
She actually looked in the interactive map, the link that you sent, and that memory care appeared as one of the participants.
That's probably a discussion that we should have offline with Carol, because that's an individual issue. We should probably do that offline.
Mm-hmm.
All right. Liz asked, there are no differences.
can I, before you go on to that, Natalia, I'm going to go to the next slide, which has, I believe, Helen's email address there.
Mm-hmm.
And so if the person who posted that question would email Helen,
Mm-hmm.
we'll be happy to get back in touch with her and delve into that just a little bit more completely than we can on this webinar
Part of
tonight,
this
but
webinar. Absolutely, yes.
please make note of Helen's email, or anyone else who's on this, make note of Helen's email as well. But for that particular question, reach out to Helen through that email and we'll make sure that we get back in touch with you.
Good.
All right, Liz asked, there are no differences in guide for people with an IDD versus neurotypical, correct? They just
Correct. Yes.
diagnosed with
it-
dementia or Alzheimer's.
Yes. There is no difference at all. Yes. So the point that we are really wanting to clarify and promote in this webinar as part of that effort is to speak to the fact that GUIDE has been established. People with intellectual disabilities are eligible for this. And this is, we're really talking about equity and access for people with disabilities to the broader healthcare system here. That's very important. But yes, there is no specific criteria one way or another that's any different for people with or without disabilities.
All right. Ruth asks, why is Medicare Advantage plan not eligible?
I can't answer the why. I was not part of the development of GUIDE under CMS, so that would be something in the development of the program that was established. One of the things I would say when you look at nursing home models, when you look at PACE models, so I would also tend to say Medicare Advantage models, they're very comprehensive models that include a broad range that are all intended to minimize access to more expensive levels of care. And so my thought would be it's something along that line, but I don't know that as a fact. And it was something determined in the design of the program.
All right. Katie asked, can respite be funded through a self-hire budget rather than through a provider?
No. Family members and individual hires are not. It has to be done through a contract relationship with the GUIDE participant organization who can subcontract it to others, but this is not a self-hire, self-payment model. No.
Good. That was a good question. Okay, so last one, I think. Do I have to change my healthcare providers who know me and my family?
No.
Oh,
I was going to say, Nancy, do you want to speak more to that?
no, I mean, I think that's a yes or no question. Do you have to change? No, because those are the people that know your family member the best. So they are the ones that, should be a part of this. There were a couple questions also in the chat about how can people access this slide deck?
Yes, I think Catherine answered that in the chat. She will send
Okay.
us a link.
Yep. We will send a follow-up email out to everyone who is registered. It will have a link to the recording. And I will send a PDF copy of the PowerPoint slides along with that. It will also be on our website, probably not till the end of the week, but it will be on the Changing Thinking page on our website. And most likely there will be a little blurb on the homepage of the website that you can click on to access that.
Mm-hmm.
There is one more question actually here that says, do we get a certificate for attending today's webinar?
No, do you want me to answer that?
Go right ahead.
We're not offering any CEUs or certificates of attendance for the webinar tonight. The primary audience was family members. And so we are not offering any certificates of attendance for the webinar this evening. We do sometimes, but not for this one.
We consider this to be an informational webinar, not a training webinar for you all, and are so appreciative that you are interested in this topic. The one thing I would say is keep an eye on this. More information will be coming, particularly as we get into the second year of GUIDE, which begins July 1st. So this really is a very new program that is evolving, and stay in touch with us at the NTG. We would be happy to provide clarification, additional information as time continues on. And this is the beginning of, I think, will be some ongoing conversations about GUIDE. So thank you all for that.
I think
And
that's all the
more
questions.
questions, Natalia? No.
That is
Well,
all.
we've run a little bit over. We thank you all for your interest in this very important topic. We also really want you to know how much we recognize and respect the role of family members, care providers, and disability providers, and the healthcare system in general, who really have been part of strengthening the system for people who are living with the challenge of dementia. Much more to come. The story is not over. We're helping to write the story, and we thank you all for your time tonight. Good night, everybody.
Thank you, everyone. Good night.